In 1950, we were the nation's first organization to focus on older adults. We advocated to secure Medicare, Medicaid, and the Older Americans Act. We helped end mandatory retirement. Today, our nation is changing and aging faster than ever before. Yet too many are still being left behind without the resources to age with dignity. We're changing that.
We've got an incredible opportunity to take the organization to the next level.
Our vision is clear: a just and caring society in which each of us, as we age, lives with dignity, purpose, and security.
I, as a senior, do not want to be swept aside. I am worth something.
Our goal is bold: improve the lives of 40 million older adults over the next decade.
They call me every day, see if I need anything, if I'm sick or if I'm feeling bad. And my own family don't do that. It makes me feel good. Somebody cares.
We're arming older adults with knowledge to stay healthy and financially secure.
It's about empowerment. It's about living your full life for as long as you can.
Age well means to be happy, to be healthy, to have opportunities.
We're supporting professionals in communities as they support older adults.
If we aren't feeding them and they don't have the other supports in their life, where are they going to get their food?
We're advocating for bold policy solutions to strengthen the social safety net for all Americans.
I think aging well should mean you have the financial freedom. You have the supports you need to navigate the inevitable complex health issues you're going to face.
I think aging well means that there is an excitement about each day.
We have so much knowledge and education that we can share with people.
We're speaking up and standing up for all older adults, no matter who they are or where they live.
And as an organization, we can bring that to bear on bolder policy advocacy agendas, real game changers. I think it's long overdue.
Because every American deserves to age well.
That was terrific. Good afternoon. Welcome. I'm Kathy Greenlee. I am the chair-elect of the NCOA Board of Directors, former U.S. Assistant Secretary for Aging. I am so glad you have joined us and hope you enjoyed that video as much as I have. It really fires me up and commits me again to working on the important issues that we'll be talking about today. But before we dive into our discussion, I have some housekeeping items I need to go through with all of you. If you are interested in closed captioning, there's a tab in the upper right-hand corner called Captions. If you click on that, you should be able to access captioning. Along the bottom, you will see two tabs. One will allow you to provide live feedback, and there's a Help tab if you're having technical issues. There are over 1,200 people attending this event, which I think reflects many of us' deep commitment to working on aging. And it's also a reflection of the very urgent times that we're living in. I believe that public policy is vital in helping society work better for everyone, for older people, for our families, our friends. And we're so glad you joined us to talk about policy and how we can work together in a nonpartisan way to shape a better future for all of us as we age. This past year has been so difficult. Older adults, especially older adults of color and caregivers, those with lower incomes have been really devastated and hit so hard by the pandemic. I'm not too proud to tell you I still cry when I watch the news about what's happening in our country. And it was just gut-wrenching when we saw what was happening and continues to happen with older people. So it's really been heartbreaking. And on behalf of all of the NCOA staff and board, I really want to extend our thoughts, good wishes and prayers, frankly, for those of you who've lost a family member, a loved one, a staff member, clients. We know there are many in the Aging Network who are so hands-on in their work that they've experienced this pandemic in a real personal way with regard to the people that they're serving. We also know that the Aging Network is a source of strength in communities. And all of us have heard so many stories of local organizations stepping up to make sure that older adults have what they needed, whether that was food, medicine, a phone call to let them know that we're out here, they're not alone. Stories of senior centers who've moved their programs online, switched from in-person meals to home delivery. I saw one video of a senior center with drive-through delivery, which also served, of course, to help overcome the social isolation because they were 6 feet apart, safe, and able to see each other in their vehicles. Senior centers are really doing their part to educate older people about initially testing, but now about the vaccine itself, and some sites are helping to administer the vaccine. The strength, resilience, and innovation of the Aging Network never ceases to amaze me. So I just want to thank you on behalf of all of us for everything that you've done, your incredible service, and your sacrifice. You are true heroes. So in addition to talking to you today about public policy, we're excited to introduce you to the new NCOA. If you've been to NCOA.org in this past week, you might have noticed some changes. We have a new modern look and a new website and a new renewed commitment to ensuring that every American can age with dignity, purpose, and security. You know, I first became familiar with NCOA 12 years ago. In 2009, when I was appointed U.S. Assistant Secretary for Aging. And I have had the pleasure of serving on the NCOA board for the last several years. I'm proud to be the chair-elect and look forward to leading this organization as the board chair starting in October. As the video said, since 1950, we have been a true collaborative leader at NCOA, from advocating for Older Americans Act programs, the Elder Justice Act, educating seniors about Medicare and their benefits. NCOA plays a unique role. And today, we are starting a new chapter that puts equitable aging at the heart of everything we do. We believe that aging well is something that every American deserves, regardless of who they are and where they live, and we're committed to making that a reality with your help. To tell you more, I'd like to introduce you to Ramsey Alwin. Ramsey is our new CEO, NCOA President and CEO. She joined us last fall. This is not her first time at NCOA. She previously worked at the organization as Vice President of Economic Security. Ramsey's a thought leader. She challenges the outdated beliefs about aging. She's been engaged in really productive conversations with the staff and the board, and really sparked new solutions to address financial resilience as we age. She previously worked to introduce the Measuring American Poverty Act in Congress to redefine the federal poverty measure to better account for the older adults' cost of living. Now Ramsey's back at NCOA, and she's going to take us to even greater heights. In only 6 months on the job, she's really defining an inspiring vision for what we can achieve together. I was surprised I didn't remember meeting her. I think I had, but it's been a delight to get to know Ramsey. And as chair-elect, I'll be able to work with her even more closely as we recommit ourselves to aging well. For all of us in the Aging Network, and certainly those of us at NCOA, it's more than a job, it's a mission that was born for Ramsey from a very personal story that places us here, right now, where we are. So here's Ramsey's story.
I've always thought aging was a social justice issue. Those that get the gift of longevity, the quality of years, the quantity of years, it's absolutely an economic social justice issue. And when I reflect on my own family's experience, my dad worked hard, he played by the rules, and he departed far too soon. He had been a lobster fisherman, and although he loved the work, being out on the ocean, living life on his own terms, it took a toll on his body. He had a history of heart issues. The health issues were certainly a piece of it, but I firmly believe that that medical debt and all the stress he experienced because of it was what ultimately made him leave us far too soon. We have to take a close look at the social contract and our investments in ensuring people are able to live a life of health and economic security. Thank you for that warm welcome, Kathy. And I may not have realized how much my dad's story would touch me and remind me. All those feelings come flooding back every time I think of the injustice that it was that he didn't get the gift of longevity. Thank you for the wonderful introduction, and everyone is welcome. Welcome to the event today. I'm so excited to be back at NCOA. It really feels like home. For more than 70 years, NCOA has built bridges for change alongside generations of families. In partnership with the Aging Network, we've worked together to end mandatory retirement, protect and strengthen Medicare and Medicaid, and advocate for the Older Americans Act. And each stride forward brought progress, improving lives, individual by individual. But today, demographic trends demand more to ensure that every person has the opportunity to age with security, dignity, and purpose. Despite increased longevity and health in the United States, our society's way of thinking about aging is still short-sighted. Our policies are outdated and unresponsive to the real disparities that many Americans face throughout their lives. The ability to age well should not be based on luck or any factor outside of our control. Yet when women, communities of color, LGBTQ, low income, and rural older adults are often victims of a broken system. Time and again, they're more likely to experience declining health at earlier ages, face higher rates of social isolation, and live near or below poverty. The most vulnerable communities lack culturally competent services and are at greater risk of that premature death. And we've seen this in the eye of the pandemic storm, which has claimed far too many older adults, in large part because of these long-standing disparities. And this doesn't have to be who we are. America is still the wealthiest nation in the history of the world. We can and must do better. The one thing that will happen to every person born in this world is that we will age. By 2030, those of us 65 and older will increase from 49 million to 71 million. After a lifetime of working hard, playing by the rules, raising the next generation, and contributing to our economy, our community, we owe it to ourselves to ensure that every older adult has the opportunity to age well, regardless of gender, color, sexuality, income, or zip code. And we can work together to change this. Guided by our goal at NCOA to improve the lives of 40 million individuals by 2030, we will focus on the diverse older adult populations that have been left behind for so many years, that have experienced so many disadvantages. This is what we're calling our Equity Promise. Our Equity Promise is posted on the NCOA website, and I encourage you to take a look. Our Equity Promise codifies what we know, what we value, and the change we want to make in the world. Our fight for equitable aging is one day at a time, one step at a time, but most importantly, it's done together. It's time that we work together to shift the paradigm and generate a national dialogue about aging as the social justice issue it is. That quality of years, those quantity of years, should not be a privilege. They should be a right that we all have the opportunity to access. The time is now, and the people to make the change are us. I hope you will stand with NCOA as we forge this new path forward together to put equitable aging at the forefront. Thanks so much for joining us today. I look forward to our additional discussions on equitable aging.
Thank you, Ramsey. Thank you for the nice kickoff, and also for allowing us to share your story with regard to you and your father. We're so sorry that he didn't get the benefit of these older years that we're all spending careers working for. I'd like to now introduce our public policy panel. A few weeks ago, Ramsey had the honor of sitting down with two champions for older adults on Capitol Hill, two members of Congress, Senator Bob Casey of Pennsylvania and Congresswoman Debbie Dingell of Michigan. Senator Casey fights every day for Pennsylvania families. He's a strong advocate for policies that improve health care and early learning of children, and policies that will raise wages for the middle class. He serves on 4 committees, including the Senate Finance Committee, the Senate Help Committee, which is Health, Education, Labor, and Pensions, and the Senate Select Committee on Intelligence. He's also chairman of the Special Committee on Aging, where his agenda is focused on policies that support seniors and individuals with disabilities. One of the things I learned when I was Assistant Secretary and living in Washington is the Special Committee on Aging continues to be one of the most bipartisan committees in Congress, where you really see Republicans and Democrats coming together to talk about issues that support seniors. And both the members who've served on the committee and certainly the staff are very proud of this bipartisan history and commitment of that committee. Senator Casey has a critical role on aging issues, including protecting Medicaid, improving access to home and community-based services, enhancing the Older Americans Act. He's championed falls prevention programs and improving Medicare low-income protections. Congresswoman Dingell was also part of the interview with Ramsey. She represents the 12th District of Michigan in the House. She's been a leader on women's issues, successfully fighting to have women included in the federally funded health research and serving as a founder and past chair of the National Women's Health Resource Center. She's a member of the House Energy and Commerce Committee. Congresswoman Dingell has been a leader on improving our nation's long-term care system, including access to home and community-based services and the elder care workforce. She's also championed to have Medicare cover the cost of hearing aids and has been active in tackling the issue with regard to prescription drug prices and chronic care issues. So we will now watch a conversation that Ramsey had with these two leaders. One thing to note as you watch, this conversation was recorded when the COVID relief bill was passed by the House, but still pending in the Senate. Since then, last week, on March 11th, it was signed into law by President Biden. The provisions that were discussed during this panel conversation with Ramsey were included in the final law. So let's take a look at the panel together.
Welcome. Thank you both for joining us. You're incredible champions for the aging issues. We appreciate your leadership and your time with us together today. We look forward to exploring some key policy priorities together. Let's go ahead and get started. Senator Casey, we'd like to start with you. We know the vaccines are here, but we're long from being done with this pandemic, and it has disproportionately impacted older adults. Could you share with us what you think are some of the top issues included in the most recent COVID relief package and how they can help older adults? And then, of course, I'd love your thoughts on anything that still needs to be done to make sure older adults are getting the support they need in light of the impact of the pandemic. Thank you.
Well, Ramsey, thank you, and it's great to be with you and NCOA at this event, and I'm especially honored to be with Representative Debbie Dingell. No one is a stronger advocate for the issues we're going to be talking about today in the entire Congress than Debbie Dingell, so I'm honored to be with her. You know, this legislation that we're working on right now, and in addition to legislation down the road, is a great opportunity to advance so many issues that relate to seniors and vulnerable Americans. Throughout the pandemic, my top priority has been to ensure that states, community organizations, healthcare providers, and frontline workers have the resources they need to protect the most at risk. The American Rescue Plan, which is obviously now passed through the House and is now pending before the Senate, will provide a measure of relief, a substantial measure of relief to seniors and so many other Americans. Along with Debbie Dingell, we led efforts in Congress to increase funding for home and community-based services, an area of investment that's been badly neglected for a long time. The bill that I had in the Senate, Senate Bill 151, would ensure that states have funds for home and community-based services to recruit and retain workers to provide hazard pay and wage increases for their workforce, because we're talking about these services, home and community-based services, where, by the way, we have a long waiting list of, at last count, over 800,000 Americans waiting for these services. We're really talking about lifting up three groups of Americans: seniors, of course, people with disabilities, and the workforce that provides the critically important care. If we say if we believe what we say, which is that we really do care about seniors and people with disabilities, we'll put our money where our mouth is and make the investment. This legislation that we're working on now is a way to open the door, get a foot in the door to begin to provide that funding. We also supported legislation earlier this year, Senate Bill 440, which had $1.5 billion to support the aging network, to support existing programs like home delivered meals, as well as vaccine education and outreach to seniors. So we have a lot more work to do in addition to the work we have to do on nursing home care, because we know that we've lost more than 172,000 Americans, either seniors or workers in those nursing homes. So we've got a long way to go on that issue as well.
Thank you so much. And Congresswoman Dingell, you're an incredible champion. What are your thoughts on the latest relief package and the needs of older adults?
Well, thank you, Ramsey. And it's an honor for me to be here with my colleague, Senator Casey, who's done so much for so many. And I'm always proud to work with him because he too is the champion in the Senate for long-term care. And our long-term care system is broken in this country. And I don't think many people, until you're in it and in trouble and need help, you don't realize how fractured and broken it is. So it's an honor to work with Senator Casey, and little by little by little, we're making progress. The American Rescue Plan had several things that we passed in the House that will help seniors. It expanded the testing, national testing strategy, but more importantly, it has resources there to expand the vaccine distribution system. And the fact of the matter is, seniors have been identified as being in that first category of people that need to get vaccines. But quite frankly, our system has had some challenges. There hasn't been enough vaccine. There's not a good communications program. And seniors are desperate to get the shot, but many of them don't have access to broadband. They don't have computers. They're not technologically savvy. They don't have the time or the stamina to stand in line, which many places require, or to sit on a phone for 8 hours to get an appointment, let alone have a computer where you keep refreshing. The American Rescue Package puts more money in to help seniors get vaccinated and to have access to the program. And as Senator Casey talked about, we have both worked very hard on the HCBS, and that we do have funds included here. The first 5 bills that have been considered on COVID had nothing for home and community-based services. And the fact 100,000 people have died in nursing homes where there have been large communities of seniors. And people deserve the right, if they can, to stay in their home if they want to stay in their home. Medicaid has been underfunded, hasn't allowed people to be able to do that, has made them sell all of their assets. And it's what's in the America Rescue Plan is based off Senator Casey's and my legislation that would provide, as the senator said, billions of dollars to ensure that seniors and people with disabilities are able to avoid the congregate settings that have been hit disproportionately if that's what they don't want to do. It's needed now more than ever, and I hope it's going to stay in on the Senate side. and that we are really going to make a difference for seniors finally, because this is something that just has to happen. You know, you're healthier when you can stay in your own home setting where you want to be, not someplace you don't want to be, and to make sure you have the support you need to stay in that setting. That's another reason this bill is so important.
Well, thank you for your leadership and for bringing voice to these important issues. We hear from senior centers, area agencies on aging, councils on aging all over the country, as well as older adults, and those are the challenges they're facing. Thank you for bringing them to the halls of Congress. Let's move to another near and dear topic for us at NCOA, equitable aging. We really believe that all, regardless of income, education, race, gender, deserve to age well with the health and economic security they deserve. However, disparities are exacerbated later in life. How can we work together? What are some policy priorities that can help us ensure all have the opportunity to age well and we can bend the curve on disparities? Would love to get your thoughts on that, Senator.
I'll start with the events of the last year. We not only had this once in 100-year pandemic and the economic calamity that flowed in its wake, but we also had the tragedies in our streets when George Floyd was killed at the hands of law enforcement, and other examples, Breonna Taylor and so many others, where I think a lot of Americans, I think I'm certainly one of them, began to, or at least began a process, a long road to begin to reckon with the issue of race. And so many Americans probably have not been willing to admit that we have a problem when it comes to structural or systemic racism in law enforcement, in the criminal justice system. But you know what? It doesn't stop there, unfortunately. There are so many inequities, or really injustices, in housing, in education, in healthcare, in the kind of environment that people live in. And when it comes to healthcare and it comes to the pandemic, we've seen that most significantly when it comes to communities of color, the adverse and really disproportional impact the pandemic has had on communities of color. Here's just one example. Research has found that long-term care facilities, just that category of care, serving significant numbers of Black and Hispanic residents, have experienced COVID-19 case and death counts three times higher than facilities serving a higher proportion of white residents. I read that slowly because I think we have to say it more than we do. And if you have a disability, which is about 25% of people over 65, you are, again, 3 times more likely to die from COVID-19 than the general population. And yet we haven't collected the data, the demographic data on COVID-19 cases and deaths in long-term care settings. So just want to mention one bill before Debbie Dingell's answer on this issue as well. Senate Bill 333, which is a bill that I've introduced to require nursing homes to collect and report on the following categories: age, race, ethnicity, and preferred language for COVID-19 cases and deaths. The data is critical for understanding the magnitude of the impact of COVID-19 has had on residents of color in nursing homes. We're far behind where we need to be on this. So we've got to address policies that level the playing field for all Americans. At its core, this is an injustice. And as Martin Luther King said, injustice anywhere is a threat to justice everywhere. And I think we're finally just beginning to reckon with this part of the challenge that we face as Americans.
I couldn't agree more, and I appreciate the issue of the data. We need to make sure we have the right data and we're addressing the root causes of these disparities. Congresswoman Dingell, your thoughts?
Thanks, Ramsey. First of all, I want to associate myself with everything that Senator Casey said. And we do know, as we've looked at COVID in this last year that it's had a disproportionate impact on the African American community and people of color. But the system, period, is broken. I think seniors, period, are discriminated against as they get older. We have a broken long-term health care system, period. And if you've ever, I unfortunately had to learn this system. And there were days, I'm supposed to know how to work it. I'm supposed to know how to work a bureaucracy. And there would be days that I would just take my head and pound it against the wall. I would be so frustrated as I would call and be put on hold and punch boo, 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 boo so many times to find, get through to Medicare and get questions answered. And you couldn't get through and it'd be round robin and they'd send you back to the insurance company. And I finally called my Congresswoman and got a couple of issues solved. But that's part of the problem. We have a fractured, broken system that discriminates against older people, period. And then when you talk about making sure that everyone should be treated equally and equitably, older African Americans have an earlier death. They die at an earlier age. And I think part of that is access to a healthcare system. They don't have access to someone that's taking care of them regularly. They don't regularly go to the doctor. They're not regularly monitored. They tend to have underlying conditions that exacerbate things that come along. So we have to make sure that that happens. But one of the, Medicare, we need to expand Medicare for everybody as well too, because one of the other things that contributes to quality of life for a senior, there are several things. Hearing, that's why I've reintroduced my hearing bill, that Medicare doesn't cover a hearing aid. And they're so expensive that many people can't afford it. And imagine what it's like to be 65, someone 65 or 70, and people have already put you into a category of being old, you're being isolated, and then you can't hear. It's not okay. And it's the same on several other issues. So, and we also need to address the high cost of prescription drugs. Again, income impacts, what you can afford and what you cannot afford. And too many seniors cannot afford their insulin. Many are diabetics. Their pills, the cost of medicine's too high. So we want to make sure that everybody is treated equitably, but I would argue that many seniors are discriminated against just because of their age, and that's morally wrong, and we have a moral responsibility to take care of our older Americans.
We couldn't agree more. At NCOA, we really believe aging is a social justice issue. The quality of years, the quantity of years, everyone should have equal access and opportunity for that quality and quantity of health span and lifespan, and look forward to working with you both to pursue policy priorities that can help us move the needle in light of aging being put front and center during this pandemic. So let's close out talking about a few other policy priorities you think are critical for us to address this year. And would love to start with you, Senator. What other horizons, what other opportunities do you see to move the needle on policy issues for older Americans this year?
Ramsey, thanks for the question. I'll respond by highlighting three areas. One that we talked about a moment ago, which is home and community-based services. Part of this, of course, isn't simply providing a greater Medicaid investment, which is long overdue and has to be part of our agenda, but also, again, lifting up the workforce who does this important work. That's why President Biden, Vice President Harris's Build Back Better plan, operative word being better, means lifting up that workforce. Instead of just saying year after year that we care about our seniors and older Americans, and we want to care about the workers who do that work, let's really invest in them and make the investment that's worthy of or consistent with our values of lifting up that workforce. And that's not easy to do unless you're willing to do the policy work. So we've got to make home and community-based services a much higher priority. I think we're going to be able to make progress even in the next few days if we can get the bill through the Senate, which I think we can, the relief bill. Secondly, as we've talked a little bit about today, nursing homes. I mentioned earlier that this bill that's ahead of us will make investments in strike teams. It'll make investments in promoting better infection control in nursing homes, as well as requiring the collection of better demographic data. But in addition to that, I've got a bill with Senator Toomey, and getting bipartisan bills in the healthcare space is pretty rare. But Senator Toomey, my colleague from Pennsylvania, and I have come together on a nursing home reform modernization act. It would expand oversight to the more than 500 nursing homes that consistently fall below or fall short of the standards we expect of long-term care. And it would increase resources for these underperforming facilities. The third and final area I'd mention is age discrimination, a little talked about but significant problem. I've got a bill to remedy one of the changes the Supreme Court made a number of years ago. The bill is the Protecting Older Workers Against Discrimination Act. And thankfully, that is bipartisan in the Senate. And this will help older adults fight back against age discrimination in the workplace. So I think if we make progress on home and community-based services, nursing home and long-term care services, as well as age discrimination, we'll have a good year.
Agreed, and we stand by to support. Congresswoman Dingell, which policy areas do you feel you'll be focusing on this next year?
Well, I agree with everything that Senator Casey said. And as I said to you, we know that our long-term care system is totally broken and fractured and needs to be worked on. And these things that Senator Casey just laid out are very, very important. But I would also add some things to that. I would work to build on the expansion and extension of existing programs like the Money Follows the Person, which we were able to get again in the House last year, and the spousal impoverishment protections. They have to be part of any conversation that's part of larger reforms. And I know Senator Casey agrees with me on this, that the high cost of drugs needs to be something we've got to take that on, period. And how we, H.R. 3, lower the Drug Costs Act last year was a bill that passed the House. And I think we'll probably fine tune it this year, but we do need to lower the cost of drugs. One of the things that I mentioned a minute ago was the hearing bill. But, the fact of the matter is Medicare does not cover hearing, teeth, and feet. I unfortunately had a jaw infection and had to have some bone graft of my entire jaw about 6 weeks ago. And the doctor came in after the surgery and said to me, people who end up where you are right now can die because they can't afford to go to the dentist. Now, I had been going to the dentist, which is why they found it, and maybe it took them too long. But I have not stopped thinking about what he said to me that night, because too many older people can't afford to go to the dentist. And yet that is, the mouth is so critical to the whole health of the body. And seniors shouldn't be afraid to go to the dentist, or just simply not go to the dentist because they can't afford it. And the same is true of feet. It's a circulation problem that can cause health problems with the whole body. We also, we need to make sure that we're investing in programs that help them maintain their health, monitor their health. There are many programs out there now that watching your weight, congestive heart failure, the way that you eat, etc. We need to invest in programs like that will end up saving the system money by an ounce of prevention. And we need to be helping seniors monitor their health more closely, high blood pressure, etc., as we're doing that. And quite frankly, I would encourage us to spend more money on public health. We spend only 3% of the budget on public health issues, and we end up with COVID pandemics. So I would encourage us to be spending more on public health, just not on mitigation. And we need to invest in current programs like the Older Americans Act that Senator Casey spoke about to ensure that they are adequately resourced and working as they were intended to.
Incredible. Thank you. Those are all the key priorities, and we stand by to support. We appreciate your leadership and advocacy on behalf of older Americans and the network of aging organizations that serve them. If we're all so lucky, we get the gift of longevity. And so we need to make sure we strengthen a system that ensures all to age with the dignity, security, and purpose they deserve. We greatly appreciate the leadership you exercise every day to fight for older Americans. Thanks so much for joining us today, and we look forward to continuing to partner.
Thank you.
Thank you. We do too.
That was terrific. I would like to extend a huge thank you to Senator Casey and Congresswoman Dingell for joining us for that conversation, and kudos for Ramsey for pulling them together. I would now like to introduce a short statement from Senator Tim Scott of South Carolina. He was not able to join us for the panel, but he wanted to add his voice to our event today. Earlier this year, Senator Scott was appointed as the ranking Republican member of the Senate Special Committee on Aging. And I had mentioned previously what a bipartisan effort that committee is. And they've been working on behalf of older Americans and tackle many issues that sometimes don't get voice other places. Retirement security has been one of Senator Scott's top priorities, and he successfully led the charge to increase access to retirement plans and enhance savings. Last year, he introduced the bipartisan REACH Act, which would codify the Centers for Disease Control program that supports locally tailored and collaborative projects aimed at enhancing health outcomes, preventing and managing chronic conditions, and reducing disparities faced by minority populations. He also played a leadership role in introducing legislation that would improve access to COVID-19 testing among individuals age 65 plus, as well as bills to promote evidence-based strategies to build effective obesity control programs and improve access to virtual diabetes prevention programs. So let's listen to the message from Senator Scott.
It's an honor to serve as the ranking member for the Senate Special Committee on Aging. By 2034, seniors are expected to outnumber children for the first time in history. Our nation's seniors have built a strong foundation for our country, and we must do everything we can to care for them. My top priority is ensuring that our seniors are vaccinated and protected from COVID-19. I'm also finding creative ways to make life better during one's golden years, growing career opportunities for older Americans, and solidifying retirement security. Last year, when the pandemic struck, I worked with my colleagues on both sides of the aisle, as well as Secretary Azar, to ensure resources and relief for senior care communities and nursing homes. That included introducing the Protecting Our Seniors from the Pandemic Act to secure test and medical supplies for older citizens. I know how important telehealth is to our nation's seniors. Just a few days ago, I reintroduced the Bipartisan Telehealth Modernization Act. This important legislation would update coverage restrictions that have long prevented life-saving telehealth services for many of the nation's millions of Medicare beneficiaries. As we work to vaccinate the American population and revitalize our economy, I will continue advocating on behalf of all of our seniors. We must address the unmet needs of our seniors and continue to support those who are working to protect them.
So I want to thank Senator Scott for making sure we had a chance to hear from him today as well. I'm sorry he wasn't able to join Ramsey for her conversation. We have now heard from 3 members of Congress, Congresswoman Dingell, Senator Casey, Senator Scott. Their voices on behalf of older people are vital in Congress. Your voices are vital as well. So we would now like to hear from you, and we're going to present to you a 1-question poll that will appear on your screen. And we'd like to know from you, which is your highest priority for public policy currently? 1, improving training and placement for older workers. 2, expanding access to evidence-based programs for chronically ill older adults. 3, making Medicare prescription drugs more affordable. 4, improving access to home and community-based services. 5, addressing digital divide and equity issues. And 6, enhancing resources to meet basic needs like food, utility, and housing assistance. Please take a moment and let us know your top priority. It would be really helpful for us to get some insight from all of you who are on this call. So, Ramsey, while everyone votes, I noticed something in Congresswoman Dingell's comments. We have a question here about Medicare prescription drugs, but she mentioned a couple of other issues that I think you and I are both familiar with regard to Medicare. The lack of coverage for hearing aids or hearing support and oral health is a huge problem. I've heard a lot from seniors about prescription drugs, but these other 2 issues are also huge problems for older people on Medicare and people with disabilities on Medicare.
Absolutely. We hear that regularly from the field and from older adults themselves. I mean, really, when I look at all of the issues you put forward with the poll in particular, we believe all 6 of these areas are absolutely critical as we continue to recover from the pandemic and focus on strengthening the economy and the infrastructure that we need to ensure all to age well. And consistent with our equity promise, we're advocating for an inclusive pandemic recovery to ensure underserved populations are represented. But we also think in this new policy landscape, there are incredible opportunities to transform the way we address issues in old age. And addressing some of the long-standing gaps in Medicare and in prescription drug assistance are top on our list. We think there's a great opportunity to address some of those challenges in this new policy environment.
So I also know we're focused on the federal budget and appropriations, and that was one part of my job that I really loved. I'm kind of a policy budget nerd. Because it's quite arduous to get additional funding, and NCOA has always been at the task and successful, frankly, in helping advance funding for programs. So I know we will continue to do that. Ramsey, let me ask you, I know we had over 1,200 people register for this event. You and I would have fun doing Q&A, but I don't think even the 2 of us can manage hundreds and hundreds of people on Q&A. So if people want to provide us feedback, how should they do so?
Well, people should absolutely visit NCOA.org and go to the Action Center. In our new and improved website, we have an entire resource center for advocates. And I challenge everyone that's joined us today to participate in advocating on behalf of these critical issues. Go ahead and visit NCOA.org, the Action Center, sign up for our newsletters, engage in some of the rich content. We have a fresh blog from our lead on all things public policy and advocacy, Howard Bedlin, that details all the key provisions in the American Rescue Plan. And take the time to visit our Contact Us form as well. Share your thoughts, your connections, the policy opportunities you see on the horizon, and ways you want to partner and engage with us. All of those opportunities are critical right now that we align and champion these issues together.
So I was on that website yesterday reading Howard's blog about the American Rescue Plan. It's very well put together. I encourage people to take a look at it. And since I just admitted to being a budget nerd, there's other things on there about the federal budget, including Federal Budget 101. It's really important that people know how to help us at NCOA get the resources we need. And there's a lot of resources in this new COVID bill. So Ramsey, I'm looking, and I think we have results now from the poll. Number 4 came in first with 43%. So that's improving access to home and community-based services. Does that surprise you? The members of Congress we just heard from mentioned that as well.
No, that's absolutely a priority that we've heard echoed throughout the field. So I'm not surprised that so many of our participants on the webinar today share that sentiment. And given the impact of the pandemic and how it has shown a spotlight on what consumers, older adults want and need, and some of the challenges in this broken system, as Representative Dingell noted, I think there is a significant opportunity here. And the American Rescue Plan is a step in the right direction. And there are opportunities for additional bold solutions to address some of the needs of consumers and some of the funding challenges experienced.
You know, I think with regard to home and community-based services, in this context, it's important to point out we're thinking broadly about that term. Sometimes that's a Medicaid term, and certainly there are Medicaid incentives to expand home and community-based services in the American Rescue Plan. But there's additional funding for Older Americans Act programs, which are also an important part of community-based services. And you really need the combination of Medicaid and non-Medicaid supports to help people. So I'm looking at what finished next after the access to home and community-based services. I think it was enhancing resources to meet basic needs like food, utility, and housing assistance. Now, neither of us are going to faint. This pulled so high. I mean, this has just, to me personally, been so noticeable as you watch the news and read stories about food insecurity now, need for utility assistance. And this falls particularly hard on lower income individuals, including older people. So what are your thoughts on that one ranking so high?
Well, it absolutely reconciles with these quarterly surveys that NCOA has run with the aging field to keep our finger on the pulse in terms of what community-based organizations are experiencing in light of the pandemic. We've been able to share those findings and trends with members of the new administration, with the Hill, and those basic needs are front and center in terms of what individuals are identifying as are most critical. My real hope here is that we've made some progress in terms of additional supports around senior nutrition and hunger issues, for instance. And as we get beyond the pandemic, the hope is that we don't roll back the progress. I know in some states and some localities, additional resources have been brought to bear so that home delivered meals can be 2 and 3 times, 2 and 3 meals for a day. Extension beyond Monday through Friday to include meals for the weekends. And so we really hope that we can learn from this pandemic in illustrating how much more the need is and make sure as we get beyond the pandemic, we are progressing forward in terms of really meeting those basic needs of older adults and not rolling back some of the progress that we've been able to achieve during this crisis moment.
Yeah, and I think one of the things that NCOA can make sure we do sort of in the context of this sort of support is make sure that people see beyond the meals. Meals are essential, and it's often what people gravitate to because it's so fundamental to life. But it was important in our question that we also highlight other kinds of supports and services people need in their homes, like utility assistance, housing support, so they can remain independent in addition to food. We really, as an organization, need to drive forward on multiple aspects of these insecurities. And looking at kind of what ranked 3, I think we had a tie. One was making Medicare prescription drugs more affordable. We've talked about that, you and I, just a little bit, in recognizing that the Congresswoman Dingell and Senator Casey mentioned that. The other one was addressing the digital divide and equity issues. And given our equity promise, will you talk a little bit more about what you think we can do as an organization to address the divide, the digital divide and equity issues? They've been so obvious, and I think they have hit, talk about an intergenerational issue, that the equity issues for older adults of color, lower income older adults, are the same as their grandchildren or great-grandchildren with regard to education. So how do you see us moving that particular issue?
Well, let me start with the digital divide. That one isn't a surprise either. We've seen and heard from the field that it's a real challenge. And the pandemic in particular, as we've all been in this shelter-in-place social distancing mode, has illustrated that connectivity to Wi-Fi, broadband, it's as basic as water and electricity. It is a basic need. And often we hear from the aging field that individuals can get connected to the hardware, they can get connected to the training, but if they don't have that Wi-Fi access, if they don't have that connectivity, none of it means anything. Despite the acceleration of telehealth and telemedicine, online grocery shopping, Zoom and FaceTime for social connectedness, if you're not able to pay for that internet connection, that digital divide really just drives the social isolation even deeper. So NCOA has been looking closely at that issue and has done some advocacy on behalf of addressing digital divide. And we're sort of exploring what the next frontier is there for us, because we do see it is a basic need. That digital connection and connectivity is a basic need. In terms of the disparities issue, the equity promise is just the beginning for us. It really lays a stake in the ground in terms of the demographic trends and the demographic groups that we know have historically been left behind. Next, we need to look at the social determinants of health and really layer in thinking holistically about all the drivers, the root causes that contribute to women aging into poverty, communities of color aging into poverty. And our commitment is to look at our programming and to raise up both the challenges and the solutions and begin an intentional, deliberate focus in our partnerships, in our investments, in the offerings and how we create them to ensure we're getting to the populations that need us most, the populations that have been left behind. So we're beginning this journey with the equity promise, sort of framing the issues for us, looking at our existing portfolio, looking at our advocacy issues, and beginning to highlight where do we need to make deeper investments so that we're really delivering on our promise. We've been public about our social impact goal of improving the lives of 40 million older adults. And internally at NCOA, we've identified that the demographic groups that we will prioritize in achieving that goal are communities of color, women, rural, LGBTQ, and individuals with income below 300% of the federal poverty, because we know those are the individuals that age into economic security, health insecurity, and they need us most.
So we have 6 questions. I'm not going to take time to talk about the other 2, but want to reassure everyone on the call that these are priorities for NCOA. And we see our policy work as leading, sharing, cheering, whatever we need to do to advance these issues. And the equity issue follows the pandemic, from the early disease and deaths to needing testing to needing vaccines, and will be part of the recovery that we focus on populations who need special outreach and attention. Ramsey, thank you so much. So let me turn it over to you to wrap us up today.
Well, Kathy, and thank you for all your leadership on the national stage. And now as our chair-elect, we're so pleased to have you at the helm starting in October. And thanks to everyone for joining us today. We've heard a lot of bold goals today: an equitable recovery from the pandemic, an enhanced support system, especially for those most vulnerable among us, and aging well for all. These are goals we all share, and we must all share in making them a reality. I ask you to join with us. Start by visiting our new website, ncoa.org. You'll find a wealth of information, as well as a chance to sign up for our news and register for our upcoming events. And I can't help but plug a few that are on the docket that I think you would like to join. So on May 6th, we'll be hosting the 4th annual Older Adult Mental Health Awareness Day Symposium in partnership with the U.S. Administration for Community Living and the Substance Abuse and Mental Health Services Administration. This day-long event is free and will cover an incredibly important topic given the pandemic's effect on mental health and wellness this past year. From June 7th through the 10th, we also invite you to join our 3rd annual Age Plus Action Conference. For the 2nd year in a row, we'll hold this event virtually, allowing you to join safely and cost-effectively from wherever you are. It promises to be even more successful than last year. We'll have over 100 live and on-demand sessions on a variety of pressing topics for professionals in the field of aging. So I encourage you to secure your spot today. Finally, I hope you'll join us in becoming an active advocate for older adults. On our website, as I mentioned, you'll find an action center with curated information and resources just for you to activate your voice on behalf of older adults. It'll provide information on where you can contact your elected officials about the issues that matter most to you and the people you serve. We need every voice calling for equitable aging. Thank you for joining us today, and thank you for joining us in this fight for equitable aging. Thank you and have a good day.